My name is Aaron Graythorne. I wanted to come out and help. I thrive in chaos. I'm living in the South Bronx of New York, working at the Lincoln Bronx Hospital. They're utilizing us as much as they can. They default to us and say, hey, what can we do? I had one surgeon. The patient was not doing well. I asked, can I do what I think is best? Just give me full control of it. And she goes, do what you need to. I said, okay, I need you to paralyze the patient for me, though. So they did. Sedated them, paralyzed them, flipped the patient into an inverse ratio, IDE ratio, meaning that your inspiratory time is a lot longer than your expiratory time. Normally, it's a short inspiratory, long expiratory. After a couple of hours, the patient completely turned around. I had to change all the modes, change all the settings. After we drew another gas and saw the patient was doing good, she goes, check my other patients, see what you can do for them. There's 10 floors. Level 1 trauma center. So they get a lot of the COVID. We have other hospitals shipping to us. I think like 7 or 8 of the floors are COVID. They're makeshift ICUs. A lot of them have 2 patients per room. We're running over 100 ventilators a day. They only have 30 vents that they keep on hand. We had to get quite a few of the transport ones to put on people. A lot of them come in short of breath. They're on a non-rebreather. They can't breathe. We'll put them on high flow or on BiPAP, try and keep them off of the ventilator. We're drawing daily ABGs. We're watching their PO2 levels. Their oxygen is what's going down the quickest. A normal person, oxygen in your blood for your arteries is 80 to 100. These people on 100% oxygen are like 50 to 60. It's not great. They deteriorate really fast. We end up having to put them on the ventilator. You have an 80% chance of dying. They're staying on the ventilator for 2 to 3 weeks. It's different for everybody. One person you treat and you think, okay, maybe I got it figured out. You try the same thing on somebody else and it doesn't work. You're constantly having to make changes on different people and running different modes on the ventilator. I think we have like 5 or 6 different types of ventilators that we're running, different brands. I extubated my first one the other day that lived, doing well, patient's in his 30s. He was on the vent for 19 days. It felt good to be able to send somebody home. From day one, it was code after code, getting calls overhead. Before I got here and before some of the other travelers got here, they were so overwhelmed. They had 150 ventilators that they were running, 25 to 30 vents each. Just not doable. On day one, we didn't have as many staff. There was a few others that got here before me. I had 19 ventilators on day one that I was trying to take care of, and it's not easy. 4 or 5 vents, 6 vents, well, you can manage. You can't manage 19 ventilators. I get told multiple times a day, thank you so much for being here. And it's not just the COVID patients that we're taking care of. They're level 1 trauma, cardiac patients, neuro patients. We get multiple traumas in a day in the ER. Definitely tiring. We're 7 days straight, 2 off, and then 7 days. We run 12 hours. Just constant ventilators. We have to wear our N95 all day long. You don't know who does and who doesn't have it. We also have face shield that we wear. I'm already starting to get breakdown on my face from it. I'm getting little bruises. I'm having to wear the mask all day. It's worth it just to save at least a few lives. A couple of doctors that when I've worked on their floor, they'll see me in the elevator. Are you working my floor today? No, like, oh, come on. Get along pretty well with all of them. We talk and we run ideas past each other. It's really just a team. It's pretty cool. I walk to the hospital every day. It's about a 10-minute walk. Everything is shut down. There's a couple of grocery stores. The buses run, but my wife good and helps me out to get a hotel next to the hospital. The majority of the restaurants are shut down. A lot of them have actually been donating food to the hospital, giving it to the healthcare workers so, we can have something to eat while we're running around. They just bring it up to the floors for us. And then with all the gear on, so we wear our regular scrubs and then paper scrubs over top of those, and then a surgical gown over that. When we go into a patient's room, we put on a plastic gown. We have our N95 on with another mask over top of it, and then we have our goggles or shield and something to cover our head, covered from top to bottom. So it gets hot fast. Yeah, I think it's starting to slow down a little bit. We're still busy up on the floors in the ICUs. The ER is slowing. We're not seeing as many positive COVIDs coming in. That's a plus. Hopefully slowing down, flattening the curve out. I'll be here for 6 weeks. I'm excited to see my kids. I'm sure I'll be more excited to come home after 6 weeks.